Hello my friends, today I'm with Alice. We have a serious injury today. Where are you from?
I'm from France.
France, okay. And how old are you?
25.
25. What's your job?
I'm a physiotherapist.
Physiotherapist, okay, a colleague. And do you practice any sport?
Not at the moment.
Not at the moment, okay. Did you have any surgeries in the past or some important trauma that you can tell me?
No.
No?
No.
Okay, but you're coming here because you have a serious injury and an important whiplash, you told me before.
Yeah, I got a little car accident, and since then I have really a lot of pain here in my cervical, and I have some tingling sensation in my arms, and I can't really lift it up, and yeah, I'm really in pain.
Okay. All on the left side.
Yes, here on the
so
left.
cervical, so the neck and the arm.
Yes.
Also your hand.
Yes, also.
Especially.
Here.
Okay. So sensitivity, lack of
Yes.
sensitivity, but you feel strength. You can lift up a little.
It's hard, especially after a
Okay.
day like this morning. It's okay, but at the end
Okay.
it's hard.
I was checking the magnetic resonance. Beatrice, you can show just a little because we have a serious injury on the cervical spine. You can see we absolutely changed the curve. So we have not a lordosis, a physiological curve, but we change the direction of the curve, and we have an important hernia right here, and we are touching the spinal cord. So it's very dangerous, and it justificates all the lack of sensitivity and the pain. Also in another view, we have the hernia touching the nerve right here on the root. So this is for the left side, and we have the injury. It's a very important condition. When did you have this accident?
2 weeks ago.
2 weeks ago. Okay, let's start. You can stay there, just sitting. Is it your first time with this kind of treatment?
For this pathology, yes.
Okay, please a little more backward. Come a little more backward. Okay. Don't worry, because I will just check your range of motion.
Okay.
And you tell me if you feel pain, okay?
Okay.
Let's start with the left side. You start to feel pain?
Yeah, it's really hard. Right
Yes,
now.
it's absolutely stuck. Then you can see it's impossible to move. And try to force a little, but look, it's impossible to go. And on the other side, it's much better. But you feel pain?
It's
Yeah, you
pulling,
start to.
It's pulling.
Okay. Now a little movement in extension. Pain.
It's okay. It's not pleasant.
Okay.
Oh.
Yes. And now we make a little flexion. Yes. Okay. And please lift up your leg. We increase the pain in this movement.
No.
Normal. Okay. The other leg, please. We increase the pain.
No.
Okay. Thank you. She made some compensation, so we are saving for the moment the spinal cord, and we are on the root of the nerve. Remember, we have an hernia on the C5 and C6, so the 5th and 6th cervical vertebra. Between them we have an important hernia.
Yeah, feel.
Yes. If I touch you, you feel pain.
No, yes.
Okay. Now relax, because I need to be very specific on the point. Just relax. Okay, don't worry, relax. Good. Take a moment to rest, okay? Let's give a moment to the muscles to release. We need to reduce the stiffness now, decrease the stiffness. Take a moment. And I will approach the opposite side in few seconds. It's very important to do this kind of you can show here, Ben, this kind of approach. We have the disc between the 5th and 6th vertebra, and we have a compression between these two vertebrae. So I just do this. I reduce the compression, so I make free the disc again. And when you apply a pressure on the disc. Obviously we have a protrusion, so we have an hernia of the disc, and we go touching the nerve. So in this case, if we reduce the compression, bring far the disc from the nerve, and we reduce the pain. Relax. Yeah, no, it's painful on this side, but don't worry. Try to relax, trust me. Yes, perfect, perfect. Yes. Good. Okay, we already worked on the fulcrum. Now I will go deep inside on the 5th vertebra. So, show here, okay, you're here. Now relax. Perfect. Okay, more relaxed. Yes, take a break. Perfect. Good. Are you okay?
Yeah.
Okay, try to move again. If you tell me if it's much better or not. Yes, you can see?
Yeah, I can see on the other side
now. Okay, so we are increasing the range of motion, the possibility to move and to apply the rotation on the neck, and then on the other side. Okay, yes, here is much easier. Okay, so just with one little approach, we reduce a lot the disease. Now you can see, you can stand up, please. We make a little bending exercise, just a test. So bend forward, okay, and you can back. Okay, okay, thank you. I always ask for this bending test, because I can touch the patient, I can give a look at the patient, I have a global view of the posture, and I find the way and the spot where I will find my beginning to start the treatment. In this case I will approach this iliac bone on the left side. Just important for the compensation. So you can lie on your back, and sometimes it looks if I'm using always the same techniques, because we are using the same techniques, but they are different for the spot I choose. In this case, this is a rumor roll, but I will work on the pelvis, so on the iliac bone. So it looks similar to the other techniques I generally apply, but this is specific for the pelvis. So relax. And just test if I prefer to apply a backward rotation or forward rotation. In this case we need a backward rotation. Okay, drop your legs. Yes, good. And now face up again, please. Perfect. Because we have 3 different compensations. The first one is on the pelvis, the second one is on the lumbar, then the dorsal, and finally we can approach again the cervical spine. Now I'm giving some minutes to relax your muscles. Also because we are reducing the stiffness of the spinal cord, so it's very important to give some moments to the patient to release. Now turn on this side, please. Okay. Straighten your legs, please. Thank you. I have a very famous English teacher. You can show him. Our assistant Adriano from USA, and he taught me how to say strengthen, because I always use stretching, but it's wrong. Thank you, Adriano.
No problem.
Now let's go on. Okay. He also correct me. Go on instead of go ahead. It's wrong too. We try to improve a little. Also the English. So now relax. Yeah, yes, don't worry. Okay. Yes, don't help me. And let's go. Good. Are you okay?
Yeah.
Could be a surgical condition. So there is a risk of a surgery here, but we will try to avoid the possibility. Now I prefer to finish all the lower side approach. So turn on this side, please. Yes, always gently. Be careful. Yes, careful is okay. Thank you. I will try to show you what I mean with compensation. For example, we have perfect line, and then here we have the moment then we change the curve, and so we have an important fulcrum to correct. Then I just touch with the palpation, I found another fulcrum, so I will apply my strength here and here to reduce this compensation. But before to do this on the dorsal spine, we need to close the lumbar chapter. So relax, okay, don't worry, relax, relax, relax. Good. Okay?
Yeah.
So that's why I need to use my classical technique, because I'm working on the fulcrums, because of the pain she changed her posture, because she tried to defend the injury, because if she feels pain here, she will not bring the head on the pain, but she will try to avoid, so she will change the posture and all the curves. Now let's finish what we started on the pelvis. Relax. Okay. It's very easy for you because we are very far from the neck, so just trust me. Okay, relax. Good. And when I work on this iliac technique, it looks the same technique for all the patients, but it's absolutely different, because I can make a forward rotation or a backward rotation. So look, it's very different. In this case I go forward, in this case I go backward. So it just looks at a first sight similar technique, but it's absolutely different for the means. And I will show you how to approach the both fulcrums we found before. Now, straighten your legs, relax, don't worry about the elbows, because I feel no pain. Relax, you don't bother me. Relax.
Oh.
Good. Don't worry. Once again, this is the last one. Now lift up your head, don't worry, okay, leave your head with me and relax. Good. Relax, relax, breathe, exhale. Yes, relax. Good. Are you okay?
Yeah.
It's a little difficult to approach this vertebra. I need to work a little more here. If we could have some issues, we will change the technique. Let's try again. Okay, lift up your head again, and now relax, relax. Okay, more relaxed, more relaxed, more relaxed. Okay, this one was good. Thank you. Yes, it's very important, the collaboration of the patient, because you are helping me a lot. In this case, we are here and nothing else, just a little fulcrum here. Okay, relax. Good, one more. Good, don't worry. Perfect. Take a moment to rest. And now that we erased all the compensations, we are ready to approach again for the second part of our treatment, the neck.
I feel really lighter already.
Lighter?
Yeah.
Okay, good. What about the pain?
It's okay.
Much better?
Oh yeah.
Yes, because we already made the most important technique, but I need to work with the rest of the neck. I think we are ready. So, Bea, you can come on the opposite side, because I will approach. Now relax. We are on the hernia right now, so relax, perfect. don't help me, relax, good. Perfect. It's very important, especially with hernial disc on the cervical spine, to don't apply a traction, because with the traction we will bring the hernia touching the spinal cord, because we will have a stiff spinal cord. We need to have a soft spinal cord, but if we apply a traction, we will have the contact. That's why I never use, because you always ask me, why don't you apply traction? I never use traction, especially for neurological disease, never. We just use many parameters like bending, like rotation, but avoiding absolutely the traction, because it's not a biomechanical and physiological technique, very aggressive. So just respect the delicate tissues we have. Now we're ready for the rest. Relax. Okay. Good. In this case I open the space for the hernia and it's done. Now please turn on your stomach. Thank you, Adriano. Adriano is a goalkeeper. The camera will say, don't do that. We usually do this, it's a tradition for us, because Adriano is an amazing goalkeeper and I like soccer or football, because depending on the different we have many friends in USA, Australia, Canada, so depending on the place, but we like both soccer and football. Okay, relax. Yes, very easy. Relax. Easy, absolutely easy. And now we need to approach an important compensation. Chi-chu. It's a thoracic vertebra. That's the second one. Now relax. Relax. Good. And carefully turn your head. I help you, don't worry. Okay, yes, you release your head. Yes, 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 perfect. Take a moment to rest. Yes. Yes, this is a traumatic result, just for the accident and the car accident, because it's not a physiological condition, so something traumatic change all the balance. Now relax. Good. And relax. Perfect. Adriano, I need your help.
Yep.
Let's approach the Sacrum technique.
Perfect.
As you already knew, is the big pressure on the pelvis, so on the sacrum. And in this case, it's not a technique for the lumbar, so for the low back pain, but is a technique for the cervical hernia, because we will reduce the stiffness of the spinal cord starting from here. So we will reduce the stiffness and we will make more free the hernia. So you can go. I prefer to approach on this side, so let's change the
switch.
Yes, and I'm sorry, we need to change again. Yes, I don't like to change too many times the position, but this time was necessary. Okay, let's go. Okay. It's very important to try to avoid the change of position of the patient, because she's feeling pain. So it's better to put just one time on the face up and face down position, just one time. So I will approach firstly all the face up techniques, and then we go on with the second part, in this case lie on the stomach. Look here, Belle, very interesting, because look, we are pulling this, the head, look, so we are working here to reduce the pressure and the compression here. I want to show you something interesting while Adriano is working.
Is that okay?
And this is what I mean. Here inside, this is the yellow side here, this is the root. And this is, inside is the spinal cord. The orange side is the sacrum, and here the purple is the cervical spine. We will make this pressure, look, to pull this side. In this case, when we will stop to work on the sacrum, we will reduce all the spinal cord pressure. In this case, we are working firstly with the manipulations, making free, unlocking the vertebra, and now reducing the pressure of the spinal cord on the hernia. Let's go on, last time.
Once more, you ready?
Let's see. Perfect. Thank you. Now we need to do something very hard. This is the side, so please turn on this side. I need your help, Adriano. Okay, be careful. Okay, please lift up the coach. Okay, you can change the the height of the coach. Yes, you can turn on this side. Okay, always carefully. Yes, relax. Thank you, Adriano. And Bea, please come here, because we need to show something very important and uncommon. Okay, we are here. This is the last compensation, so relax. Okay, leave your head with me. Okay, drop your leg on my forearm. Okay, relax, don't worry. Yes, in this case it's not a rotation, it's a derotation, and not a flexion but an extension. Relax. Okay, perfect, perfect, wonderful, perfect. Okay, this is a very hard technique and necessary for this case. I will not use my Sphinx technique that you know and you really like, because in this case it's absolutely forbidden, because we cannot use this technique of the Sphinx. In this case I use the lateral approach on the first and second thoracic vertebra. Perfect. Now face up. I think it's perfect. Absolutely reduced. So we already treat the hernia. There is no compression. The root is absolutely free. And now we will see together the results. I need to do just one technique. I think this is because of the trauma. So please help me, Adriano.
Yep.
Thank you. Yes.
No problem.
And it's a little dangerous because I need to work on a rotation for the occiput, but I don't want to stress the spinal cord. So let's try. You relax, don't worry. Okay, yes. Perfect. Yes, don't worry. Yes. Are you okay?
Yeah.
Is it comfortable? Okay, relax. Don't worry, don't worry, don't worry. Relax. Yes. Good. Okay. Please the stool.
Yep.
And now, carefully, if you feel dizzy, stay with us, don't worry. Just look at the point. So sit on this side. I will help you. Yes. Perfect. Okay. Any dizziness? No?
No.
Okay, look forward. It's not the moment for the test, but for the last technique. So, please come a little more backward. I always do this technique at the end of the treatment because I need to make and apply a, yes, really release your muscles. I need to reduce a dysfunction on the occiput. So it's important to work right now when I already treat all the rest of the vertebra because I need to be very specific on the spot. So now I am absolutely sure that we have only the last expansion on the occiput. Look, I can make the rotation because she doesn't feel pain. Now relax, yes, drop your head, relax. Don't worry, don't worry, don't worry. Good. Are you okay?
Yeah.
Perfect, finish. We finished now. Okay. Yes, this is a a little fatigue. It's normal with this kind of patient. You were great, eh? You helped me a lot, so good job. Okay, now, you okay?
Yeah.
Yes, try to move your neck. You can see, there, show, please. You can see the rotation is absolutely increased. When you came inside today, in a scale between 0 and 10, the pain was?
Oh, it was an 8, I couldn't sleep.
Okay, so it's the maximum of the sensation. And now, between 0 and 10 is?
Oh, it's like a 2 or...
2,
Yeah,
okay.
3.
So it's just a little inflammation, and we will reduce this condition in 2-3 hours or maybe in 1-2 days. Good. Please make a flexion. Yes. Pain?
No.
No. And an extension. Okay? Now open a little your mouth and go more. Yes. Pain? No. So the maximum of the extension, there is no pain. Okay. Thank you, Alice.
Thank you.
Okay. Any questions? No?
No.
Okay.
Happy.
I will give you just Adriano.
Yeah.
You will explain because I finish my part now, so the physiotherapist will start all the recovering of the neck, the muscles, and you have the protocol for the stretching. So it will be a physiotherapy specific to recover the length of the muscles because we have restricted muscles. So stiffness muscle is very important. Stiff muscle is very important to recover the length of the muscle, and you will do it. Thank you.
Perfect.
So we will explain you how to do it. Let's say goodbye to our friends.
Goodbye.
Like this. 3, 2, 1.
Bye, guys.
Bye bye.